What if I told you that the answer to your knee pain, that constant, exhausting, life-stealing pain that stops you from walking, gardening, playing with your grandchildren, and enjoying the life you worked so hard to build, is sitting in your kitchen right now? Not a prescription, not an injection, not another surgery, just one simple drink that you sip every single morning that begins working inside your knee joints from the very first day. No more waking up and immediately dreading the pain. No more canceling plans because your knees just will not cooperate. No more feeling like your own body is working against you, because today everything changes. Today you finally find out what is actually possible for your knees in just 14 days. And here is what makes this even more powerful. Orthopedic researchers have identified a specific combination of natural compounds that, when consumed together every single morning in one simple drink, directly targets the three root causes of chronic knee pain: joint inflammation, cartilage breakdown, and synovial fluid depletion. And the results from multiple clinical studies are nothing short of remarkable. Patients with moderate to severe knee osteoarthritis who consumed this drink daily reported significant reductions in pain, stiffness, and swelling in as little as 14 days. Not months, not years, 14 days, no side effects, no prescriptions, no needles, just one drink every morning that your knees have been desperately waiting for. And today I'm going to give you the exact recipe. So stay with me all the way to the end of this video, because I promise you, what you are about to learn is going to completely transform the way you think about knee pain and what is genuinely possible for your joints at any age. And if you are new to this channel, welcome. Hit that subscribe button right now, because every single week we bring you honest, research-backed, and life-changing health information that your doctor probably never had time to explain to you. This community is growing every single day, and I do not want you to miss a single video. Now let us get into it. Let us start by understanding what is actually happening inside your knee joints when you experience chronic pain. Because once you understand the root cause, the solution makes complete and perfect sense. Your knee joint is one of the most complex and most heavily used joints in your entire body. Every single day, it absorbs the equivalent of 3 to 5 times your body weight with every step you take. Inside the joint, you have cartilage, a smooth, rubbery tissue that cushions the ends of your bones and allows them to glide against each other painlessly. You have synovial fluid, a thick, lubricating fluid that fills the joint space and keeps everything moving smoothly. And you have a complex network of ligaments, tendons, and soft tissues that hold everything together and provide stability. When knee pain becomes chronic, it is almost always driven by 3 interconnected problems happening simultaneously inside your joint. The first is inflammation. Chronic inflammation in the knee joint causes the synovial membrane, the lining of your joint, to become irritated, swollen, and painful. This inflammation releases enzymes called matrix metalloproteinases that actively break down cartilage tissue. The second problem is cartilage degradation. As cartilage breaks down, the bones in your knee begin to lose their cushioning and start to rub against each other. This bone-on-bone contact is what creates that deep, grinding, aching pain that is so characteristic of advanced knee osteoarthritis. The third problem is synovial fluid depletion. When the knee joint is inflamed and under chronic stress, the quality and quantity of synovial fluid deteriorates. Without adequate lubrication, every movement becomes painful friction instead of smooth, effortless motion. Most conventional treatments, anti-inflammatory medications, cortisone injections, and eventually knee replacement surgery, address the symptoms of these 3 problems, but do not address the underlying biological processes that are causing them. That is why so many people get temporary relief, but the pain always comes back. What we need is something that works at the cellular level to reduce inflammation, protect and rebuild cartilage, and restore the quality of synovial fluid. And that is exactly what this morning drink does. So what is in this drink? The morning knee pain relief drink is a powerful combination of 5 natural ingredients that each target a specific aspect of joint health and together create a synergistic effect that is far more powerful than any single ingredient alone. Let us go through each ingredient, what it does, and why it is in this drink. The first and most important ingredient is turmeric. Specifically, 1 teaspoon of high-quality organic turmeric powder. Turmeric contains a compound called curcumin, which is one of the most extensively researched natural anti-inflammatory substances on the planet. A landmark meta-analysis published in the Journal of Medicinal Food analyzed multiple randomized controlled trials and found that curcumin supplementation produced significant reductions in knee pain and improvements in physical function in patients with knee osteoarthritis, results that were comparable to ibuprofen but without the dangerous side effects on the stomach, kidneys, and cardiovascular system. Curcumin works by blocking NF-κB, a molecular pathway that is one of the primary drivers of chronic joint inflammation. When you block NF-κB consistently every single day, you are turning down the inflammatory fire that is destroying your knee joint from the inside. The second ingredient is fresh ginger, half a teaspoon of freshly grated ginger or high-quality ginger powder. Ginger contains powerful bioactive compounds called gingerols and shogals that have been shown in multiple clinical studies to reduce joint pain and stiffness. A study published in the journal Arthritis and Rheumatism found that patients with knee osteoarthritis who consumed ginger extract daily experienced significantly less knee pain when standing and walking compared to those who received a placebo. Ginger also has the remarkable ability to inhibit the same inflammatory enzymes, COX-2 and prostaglandins, that are targeted by common pain medications like aspirin and ibuprofen. The difference is that ginger does this naturally and without the damaging side effects associated with long-term NSAID use. The third ingredient is black pepper, just a small pinch, about 1/4 teaspoon. Now you might be wondering why black pepper is in a knee pain drink. The answer is a compound called piperine. Piperine is the active compound in black pepper that has been shown to increase the bioavailability of curcumin, the active compound in turmeric, by an extraordinary 2,000%. Without black pepper, your body absorbs very little of the curcumin from turmeric. With black pepper, suddenly almost all of it becomes available to your cells. This is one of the most important and most overlooked aspects of making this drink actually work, and it is the reason so many people who take turmeric supplements alone do not get the full benefits. The fourth ingredient is collagen peptides. 1 tablespoon of hydrolyzed collagen peptide powder. Collagen is the most abundant protein in your body, and it is the primary structural component of your cartilage. As we age, our natural collagen production declines dramatically, starting as early as our mid-20s and accelerating significantly after 50. When collagen production falls, cartilage has no raw material to repair and rebuild itself. A double-blind clinical study published in the International Journal of Medical Sciences found that patients with knee osteoarthritis who consumed hydrolyzed collagen peptides daily for 90 days experienced significant improvements in joint pain, mobility, and quality of life compared to placebo. The collagen peptides are absorbed into the bloodstream and selectively deposited in the cartilage tissue of the joints, providing the building blocks your knees need to actually repair and regenerate damaged tissue. The fifth ingredient is warm water with fresh lemon juice. The warm water serves as the base of the drink and helps with absorption of all the other ingredients. The lemon juice, from half a fresh lemon, provides vitamin C, which is absolutely essential for collagen synthesis. Your body cannot produce collagen without adequate vitamin C. It acts as the enzymatic cofactor that converts proline and lysine, the amino acid building blocks, into the actual collagen protein. Additionally, vitamin C is a powerful antioxidant that neutralizes the free radicals that contribute to cartilage breakdown and joint inflammation. Starting your morning with warm lemon water also stimulates your digestive system and helps your body absorb all the other powerful compounds in this drink more efficiently. Now, I want to stop right here and share a story with you that is going to make everything we have been talking about feel real and personal and possible. Daniel is a 64-year-old retired firefighter from Chicago, Illinois. 30 years of running into burning buildings, carrying heavy equipment, and working on hard concrete floors had taken a serious toll on his knees. By the time he retired at 60, both of his knees were diagnosed with moderate to severe osteoarthritis. The pain was constant, it was deep and grinding and relentless. Simple tasks that most people take completely for granted, walking to the mailbox, climbing the stairs to his bedroom, getting up from the couch to answer the door, had become genuinely painful ordeals that he dreaded every single day. His orthopedic surgeon had already mentioned the possibility of knee replacement surgery, and Daniel was terrified. He had watched his older brother go through a knee replacement, and the recovery had been brutal. He was desperate to find another way. Daniel's daughter, who is a nutritionist, came across research on natural anti-inflammatory compounds and their effects on joint health. She put together this exact morning drink recipe for her father and convinced him to commit to drinking it every single morning for at least 30 days before making any decisions about surgery. Daniel was skeptical. He was a no-nonsense, practical man who had spent his career dealing with real emergencies, and he was not naturally inclined toward what he called kitchen remedies. But he trusted his daughter, and he was desperate enough to try anything, so he committed. For the first 5 days, Daniel noticed nothing significant, just a very slight reduction in the morning stiffness that usually lasted the first 2 hours of his day. By day 8, he noticed that he was getting out of bed faster. The grinding sensation when he walked downstairs felt slightly less severe. By day 12, his wife noticed that he was moving around the house without the grimace that had become permanently etched on his face whenever he walked. And on day 14, exactly 14 days after his first glass, Daniel walked from his front door to the end of his street and back without stopping, without grimacing, and without needing to hold on to anything for support. He stood at the end of that walk with tears in his eyes, because it was the first time in 4 years that he had done something that simple without pain. Daniel continued the drink every morning, and by the end of 6 weeks, his pain had reduced by what he estimated was about 75%. He went back to his orthopedic surgeon 3 months later, and his doctor was genuinely surprised by the improvement in his functional mobility. The surgery conversation was taken completely off the table. Daniel now gardens in his backyard every weekend, takes daily walks with his wife, and recently told his daughter that this drink gave him his life back. He makes it every single morning without fail and says it has become the most important 2 minutes of his entire day. Now let us talk about exactly how to make this drink so you can start tomorrow morning. The recipe is simple, the ingredients are inexpensive and widely available, and the whole process takes less than 3 minutes from start to finish. You will need 1 cup of warm water, not boiling, just comfortably warm. Squeeze in the juice of half a fresh lemon. Add 1 teaspoon of organic turmeric powder. Add half a teaspoon of fresh grated ginger or ginger powder. Add 1/4 teaspoon of black pepper. Add 1 tablespoon of hydrolyzed collagen peptide powder. You can optionally add a small drizzle of raw honey, about half a teaspoon, both for flavor and for its additional anti-inflammatory properties. Stir everything together vigorously until fully combined and drink it immediately on an empty stomach first thing every morning before eating anything else. Drinking it on an empty stomach maximizes the absorption of all the active compounds and gives your joints the full benefit of every ingredient. A few important practical notes. When buying turmeric, always choose certified organic to avoid pesticide contamination. When buying collagen peptides, look for products that are grass-fed, hydrolyzed, and third-party tested for purity. When buying ginger, fresh is always best, but high-quality powder works well too. And always use fresh lemon juice rather than bottled lemon juice. The vitamin C content in bottled juice is significantly lower due to processing and shelf time. The key to making this drink work is absolute consistency. You cannot drink it 3 days, skip 2 days, drink it 1 day, and expect results. The compounds in this drink build up in your system over time. The anti-inflammatory effects of curcumin, gingerols, and vitamin C accumulate with daily consistent consumption. The collagen peptides need time to be absorbed, transported to your joint tissues, and integrated into the repair process. Consistency is everything. Commit to 14 days at minimum, ideally 30 days. And pay close attention to how your knees feel each morning when you get out of bed, each time you climb stairs, and each time you rise from a seated position. Most people begin noticing measurable differences between days 7 and 14. Let us also talk about what to pair with this morning drink to maximize your results even further. Add wild-caught fatty fish like salmon, mackerel, and sardines to your diet at least 3 times per week. The omega-3 fatty acids EPA and DHA are among the most powerful natural anti-inflammatory compounds known to science, and they work synergistically with the curcumin and ginger in your morning drink. Eliminate or dramatically reduce ultra-processed foods, refined sugars, and industrial seed oils from your diet. These are the primary dietary drivers of systemic inflammation that feeds your knee pain every single day. Add a daily walk, even just 10 to 15 minutes at a comfortable pace, to maintain joint lubrication and strengthen the muscles that support your knees. And consider adding a warm Epsom salt soak for your knees 2 to 3 times per week. The magnesium in Epsom salt absorbs through the skin and has been shown to reduce muscle tension and joint inflammation. The bottom line is this: chronic knee pain does not have to be a permanent sentence. It does not have to mean a life of painkillers, injections, and eventually surgery. Your body has a remarkable capacity to reduce inflammation, protect cartilage, and restore joint function when you give it the right nutritional tools consistently every single day. This morning drink is not a magic cure, but it is a powerful, science-backed, natural tool that is giving real people like Daniel their lives back, one morning at a time. Start tomorrow, make your first glass, commit to 14 days, pay attention to how your knees feel each morning, and give your body the real chance it deserves to heal. Now, before you go anywhere, drop a comment below right now and tell me your age and the city you are watching from. And tell me, how long have you been dealing with knee pain? Have you tried anything natural that has helped? I want to hear your story because your experience could inspire someone else who is watching this video right now and desperately needs hope. I read every single comment personally, and I genuinely love connecting with this community. And if this video gave you something valuable, if it gave you hope, if it taught you something you did not know before, please share it right now with someone you love who is suffering from knee pain. This could change their life. Hit that subscribe button, turn on the notification bell, and I will see you in the next video. Take care of your knees because they carry you through every single moment of this beautiful life. This video is created strictly for educational and informational purposes only and does not constitute medical advice, medical diagnosis, or any form of treatment recommendation of any kind. The information shared in this video is based on publicly available scientific research, peer-reviewed clinical studies, and general wellness and nutritional information available at the time of recording. The patient story featuring Daniel has been included solely for illustrative purposes to reflect real-world experiences that are consistent with existing clinical research findings on natural anti-inflammatory compounds and joint health. Individual results will always vary significantly from person to person based on age, overall health status, severity of joint damage, underlying medical conditions, current medications, lifestyle factors, and other personal circumstances. Turmeric, ginger, collagen peptides, lemon, black pepper, and any other foods or supplements discussed in this video may interact with certain medications or pre-existing health conditions. Always consult with a board-certified physician, rheumatologist, orthopedic specialist, or other qualified licensed healthcare professional before making any changes to your diet, supplement routine, or health protocol, particularly if you are currently taking blood thinners, diabetes medications, or any other prescription medications. The creator of this channel is not a licensed medical professional, registered dietitian, or certified nutritionist. No statements made in this video have been evaluated or approved by the United States Food Administration. No food, drink, supplement, or lifestyle recommendation mentioned in this video is intended to diagnose, treat, cure, or prevent any disease or medical condition. Never disregard professional medical advice and never delay seeking appropriate medical care because of something you have seen or heard in this video. If you are experiencing severe, worsening, or debilitating knee pain, please seek immediate evaluation from a qualified licensed healthcare provider. Viewer discretion is always advised.